Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about the different incisions that we use in rhinoplasty. So our incisions will vary a lot depending on the approach we take. We'll be discussing each one of them. Where do we put this incision and what are some indications for using those incision and what are some advantages and disadvantages of each of the incisions. You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our class. So we do have a lot of different incisions, as I mentioned, in rhinoplasty, and we choose which one to use depending on, first of all, our surgical approach, whether we are taking an open approach or a closed approach rhinoplasty, and also based on the deformity, the type of deformity in the patient, what is the need for exposure, whether this is a primary surgery or a revision surgery, if there is a tip involvement in the case or not, and also according to the preference of the surgeon. So there's these factors that we keep in mind when we are deciding which incision do we want to approach with. So now we'll first talk about the classification of the different incisions. So let's classify them on the basis of the approach that we are taking. So we have our open approach rhinoplasty and then we have our closed approach rhinoplasty. Open, also known as the external rhinoplasty, and closed, also known as the endonasal rhinoplasty. So now in open rhinoplasty or external rhinoplasty, where we are basically giving an external incision, the two incisions under this are, the one that is usually used more commonly is the transcollumellar incision. So this is what we definitely need to know about. There's another incision under the external approach called the Alar incision, which is only used in certain cases. Then we have the closed rhinoplasty or endonasal rhinoplasty, where all the incisions that you are giving inside of the nose, and we are not giving any external incisions on the skin here. So we have over here intercartilaginous incision. Then we have transcartilaginous incision. Then we have infracartilaginous incision. Now, transcartilaginous incision, this one is also known as the intracartilaginous incision. And then we have the infracartilaginous incision, which is also known as the marginal incision more commonly, or the rim incision. And along with this, we'll also talk about the transfixion incision, which we have learned under septoplasty. So let's first look at each one of these incisions in the image and then we'll talk about each one of them. So if you look at the image over here, our first incision is the intercartilaginous incision. You can see how this is the intercartilaginous incision, which means we are giving in between two cartilages, the upper lateral cartilage and the lower lateral cartilage. Then is a transcartilaginous incision. Now, as the name suggests, the transcartilaginous incision is going through the cartilage. So this is also known as intracartilaginous incision, which means an incision given through the cartilage, and we are giving it through the lower lateral cartilage. Then third, we have the infracartilaginous or the marginal incision, and this is the one that we give along the margin of the lower lateral cartilage or the alar cartilage. Since we are giving it below the cartilage, this is also known as the infracartilaginous incision. Then we have our transcollumellar incision. So the transcollumellar incision is an incision that we give in the collumellar region. If you look at the image here, this is the transcollumellar incision, and we have the alar incision here. This is our alar incision over here. This has very specific use cases. And lastly, we have the transfixion incision, which is the incision that we give over here. You can see this is a transfixion incision. So now let's talk about each one of these incisions in details. So first one is our intercartilaginous incision. Now, as I mentioned, also the name is suggesting inter, meaning in between two cartilages. So we are giving this incision in between the upper lateral cartilage and the lower lateral cartilage. So this is an incision that we placed internally in the soft tissue scroll area between the caudal margin of the upper lateral cartilage and the cephalic margin of the lower lateral cartilage. And this incision runs parallel to and just above the lower lateral cartilage. Now, what are some indications of using this incision? Usually, we use these incisions in cases of, say, when we have dorsal hump reduction, or we have to do nasal bone osteotomies. This incision is not preferable if you have major surgery involving the tip. So, only in cases where we have a very limited tip involvement or tip refinement needed, those cases can be done using this incision. And another very important indication is that you can easily combine this incision with the transfixion incision to get a full endonasal access. So, these are some basic indications of using this incision. So let's understand also what are some advantages of this incision. So because first of all, we are placing the incision inside the nose, we have no external scar. So this is basically a hidden incision. Next is we get a very wide access to the nasal dorsum and the bony vault of the nose. So this is a nasal dorsum and the bony vault lies over here. We get a very good access to this area, but we do not get a good access to the tip area of the nose. And because we are able to combine this incision with the transfixion incision, this can also give you very good septal exposure. And another advantage is this also preserves the interdomal ligaments that are present in the nose. So these are some advantages of the intercartilaginous incision. Next, coming to disadvantages, as I already mentioned, we cannot get much of an access to the tip. So we do not have we have a very limited tip access over here. Second is if we end up while giving the incision, because we are giving an incision in the soft tissue scroll area, we end up causing disruption to the scroll area that can lead to alar retraction. Third disadvantage is this does not allow the full delivery of the lower lateral cartilage. So any surgery where we require a full exposure, a full delivery of the lower lateral cartilage, we should not be using this incision. And this incision can also end up disrupting the internal nasal valve area. So these are some disadvantages that we should be aware of, and depending on our case, choose an indication. If it aligns with this incision, we choose that. If it doesn't, we make another choice. So this is our first incision, the intercartilaginous incision. Next, let's move on to our second one, which is the transcartilaginous incision. Now, transcartilaginous incision, let's look at the image here. This blue line over here, this is a transcartilaginous incision. And as the name suggests, the incision is actually going through and through the cartilage. So this is an incision that we make through the substance of the lower lateral cartilage, also known as the alar cartilage. And usually we give it at a distance of 3 to 5 millimeter caudal to the cephalic end of the lower lateral cartilage. So this distance is usually 3 to 5 millimeter. And this incision is placed parallel to the caudal border of the lateral crust of the alar cartilage. We have spoken about the different parts of the alar cartilage. It has three parts: the medial crust, the lateral crust, and the dome. We have spoken about this in the surgical anatomy video earlier. You can check it out to understand more about the anatomy related to rhinoplasty. So when do we use this incision? So this incision, as the name mentions, it's transcartilaginous, or the other name is intracartilaginous, meaning going through the cartilage. Some indications of this is since we are going through the middle of the alar cartilage, one of the indication would be when we required to trim the cephalic end of the lower lateral cartilage. If this is required for doing tip refinement of the patient, then we take this incision. Second is if the patient has a bulbous or a boxy nasal tip. In these cases, we also use this incision. Now, let's try to understand what are the advantages and disadvantages of this incision. So, our first advantage is that here we are not going through the scroll area. So, our scroll area is preserved. The The integrity of this region is preserved. Second is, it is very good for a controlled cephalic trim of the lower lateral cartilage, as I mentioned as one of the indications. Third, it causes very minimum structural disruption. Next, it also decreases the risk of nasal obstruction. Why? Because here we are avoiding the nasal valve area. So the chances of a scar contracture forming involving the nasal valve area is lesser. Therefore, there is a decreased risk of nasal obstruction. Fifth, a very obvious one is that there is no external scar involved here because we are giving an incision inside the nose. And lastly, we have good access to the tip in this incision compared to the intercartilaginous incision. So these are some advantages that we have regarding the transcartilaginous incision. And talking about the disadvantages, first disadvantage is that if you end up removing excess of the alar cartilage, in that case, it can actually end up weakening the cartilage. And second is, it has limited exposure as compared to the first incision that we discussed today. So this is about the transcartilaginous or the intracartilaginous incision. Next, we come on to the infracartilaginous incision. Infra meaning below. Meaning, if you look at the image over here, this is below the alar cartilage. We are giving this incision. Therefore, this is known as infracartilaginous incision. The other two names that we also know this incision by is marginal incision or rim incision. We very commonly use the term marginal incision over here. So this is an incision that we are giving along the caudal border of the lower lateral cartilage inside the nostril rim, and we start at the medial crural footplate and extend it towards the alar rim. Now, another part that you need to know is this incision. If you combine it with the intercartilaginous incision over here, in that case, it will create a bipedicled chondrocutaneous flap, which will allow, because this is the total incision now, if we combine them, then this will allow the complete delivery of the lower lateral cartilage out of the nose for direct inspection and modification. So this is why we have an added advantage here that we can create a flap using this. Now let's try to understand what are some indications involved over here. Now some indications is if we are doing tip rhinoplasty, which requires a full access to the lower lateral cartilage, this would be a good incision to go for. Second is, again, if we have some kind of asymmetric tip or some complex tip deformity, and this can also help in delivery technique for cartilage grafting. Now, next is advantages of this incision. So, advantages of the incision is, first of all, we do not have an external scar because this is a endonasal incision. Second is, we can completely deliver the lower lateral cartilage and expose it. So that is very important. Third is, we get a very good exposure and access to the tip of the nose. And fourth is, this can be easily converted to the external approach rhinoplasty. So these are some advantages of this marginal incision that we are using. Disadvantages would be, because we are giving at the lower border of the alar cartilage, there is a risk of alar notching and alar retraction if we don't place it properly. Second is, we are not able to access the dorsum of the nose like we were able to in intercartilaginous incision. So that is another disadvantage. And third is, because of the incision, there can be edema of the nasal tip in the post-operative period. So this is about the infracartilaginous incision that we have. Now these were the three endonasal approach incisions. Along with this, we have another incision to discuss here, which is the Transfixion incision. Now, this is something that we have already discussed when we were talking about septoplasty incisions. We'll just quickly cover this. So, this is an incision that we make in the through the membranous septum in the columella between the medial crura of the lower lateral cartilage and the caudal septum. So, this incision that you see over here, this is the transfixion incision, we are making it through the membranous septum. So to understand more about the septal anatomy, the different parts of septum, it's not just the bony and the cartilaginous part. We have our columnar septum, we have membranous septum, and then we have the osteocartilaginous part of the septum. To learn more about the anatomy of the septum, I have a separate video. You can check it out over there. So here we are making an incision through the membranous septum in the columella. And there are three variants to this incision. First is if we are doing a complete transfixion incision, meaning this is a full thickness incision, we are going through and through the membranous septum from one side to the other. So there is a both side full thickness incision involved here. This what it will do is it will completely separate the medial crura from the septum. Second is it can be a hemitransfixion incision, meaning we are giving only one-sided incision. We are giving it only on one side of the membranous septum only. Third is a partial transfixion incision where we are giving a bilateral incision on both the side in the membranous septum, but we are not extending it to the level of the anterior nasal spine. We are only giving it for a partial distance. We are not giving it right up to the nasal spine. This will help to preserve some support to the nasal tip area. So this is a little bit about the transfixion incision and the three variants that we have here. Now, when do we use this transfixion incision? What are some indications over here? So some indications would be if you also need to do a simultaneously concurrent septoplasty along with this rhinoplasty. So in septorhinoplasty, we will prefer this transfixion incision. Second is if we need to do a caudal septal resection in the case. Third is if we need to reduce the nasal spine. Fourth is if we need to perform columellar shortening. And fifth is if we need to do a tip deprojection, meaning in a case of overprojected nose, we are trying to deproject the tip. In that case, this incision would be useful. Now, what are some advantages of using this incision? So, the first advantage is that we have excellent exposure to the septum, the caudal septum, the nasal spine. Second is this incision will actually help you in harvest the septal cartilage. Third is we can, when we combine it, we already spoke about this, that when we combine transfixion with the intercartilaginous incision, it will give us full access to the whole endonasal area. So that is actually a very important point. And fourth advantage is again that it is a hidden incision, so we do not have an external scar. So these are some advantages. Coming to disadvantages, if you give a complete transfixion incision, as I mentioned, then in that case, what happens? There can be a major problem in the tip support mechanism. And also there can be a risk of columellar retraction in this case. So that's about the transfixion incision. Next, we move on to the two incisions that we are going to talk under external or open rhinoplasty. So the most common one that we use is the transcolumellar incision. If you look at the image over here, this is what the transcolumellar incision looks like. So if we look at the columella, this is the columella, right? We place an external incision transversely across the columella, and this is commonly combined bilaterally with the marginal incisions inside the nose. Now, this incision can be of different types. You can be giving a inverted V type of incision. We can give a W incision. We can give a staircase incision. We can give a low columellar incision. We can give a mid columellar incision, and we can give a gull wing incision. So it can be a variety of types depending on the shape and the exact region that we are giving it. Now, some indications for this is because this is the major incision used for open rhinoplasty. So the indications for open or external rhinoplasty becomes the indications of using the transcolumellar incision. So some indications would be complex deformity, revision rhinoplasty, cleft nose, severe tip asymmetry, major reconstruction required, extensive grafting required, or in cases of teaching purposes. So in teaching purposes, doing a closed approach will not give much of visual visual access to the students. So external rhinoplasty is very good for teaching cases. Next, let's talk about what are some advantages of using this incision. Some advantages is that, first of all, that it will give you very good exposure of the tip, the septum, the dorsum, and the lower lateral cartilages. And since it is, we are getting such good access that it will give a very good diagnosis, precise diagnosis of the deformity. And it will also help you in accurate placement of sutures and grafts, very ideal for teaching, and better assessment of symmetry of the deformity or the symmetry of the nose. And some disadvantages would be a very obvious one, that we have an external scar on the columella. However, the scar does end up healing, so doesn't leave much behind in a couple of weeks or months of the surgery. There can be prolonged tip edema in these cases, longer operative time because the external approach takes more time, greater disruption of the tip support mechanisms, and a longer recovery time. So that's about the transcolumnar incision, the most common incision that we use when we are doing an open rhinoplasty or an external rhinoplasty. Last of all, we have the Alar incision. Now this here is the Alar incision. Now you can see. So now Alar incision is actually an external incision which is placed at the alar facial groove, which is the junction of the ala with the cheek or the upper lip. And we are placing the incision outside the nostril entirely. So this is an external incision. Indication of this would be if the patient has a very wide alar base. Wide alar base meaning if this is the alar of the nose, the width of the alar, the interalar width is actually more than the intercanthal distance, which is the distance between the two medial canthus of the eye. Second is if there is excessive alar flaring, this incision is also preferred. Some advantages of using this incision is that this is very effective in narrowing the nostril, and the scar can get hidden in the alar crease, so it may not be visible. But another disadvantage would be if you have not placed the incision properly in the exact area required, then you may end up with a visible scar. And if you do over resection, then it can lead to notching or distortion. And lastly, nostril asymmetry is very possible in this incision. So these are all the different incisions, the 6 different incisions under the 2 different approaches that we have to rhinoplasty. If you have any doubt regarding this, please note them down in the comment section and I'll get back to you. Thank you.